morning students, this is Steve from Assistant Professor from Department of Pharmacology. From today we are going to discuss about the good pharmacy practice in hospital pharmacy. Okay, good pharmacy practice in hospital pharmacy. Okay, shortly we call this as GPP. Okay, first of all, good pharmacy practice. Okay, for good pharmacy practice is one of the it is one of the pharmacy. It's a community. It's one of the community, and otherwise it's only maintained in the hospital sector. Otherwise, private sector regions are also only. Okay, it's a simply we call as a good pharmacy practice. The medicine can establish and the medicine can be established and distributed to the patients in a good side. Okay, good pharmacy side. Okay, it is called as a good pharmacy practice. Okay, from the section the GPPs. Okay, GPPs are also known as a good pharmacy practice. Okay, good pharmacy practice is one of the community. Okay, it's one of the community and the pharmacy management. Okay, pharmacy management and pharmacy standards and otherwise the pharmacy services are also involved in it. Okay, from the side of good pharmacy practice. Okay, and the act were created by the where it's created by means it's created by the international federations. Okay, international pharmaceutical federations in the year of 1992. Okay, it is one of the good pharmacy practice. Okay, it's a good pharmacy practice. One of the management. It's one of the pharmacy and it's a hospital. It's one of the community and hospital pharmacy. And standard procedures and pharmacy procedures can also establish them, and the maintaining some procedures and it also establishing them. Okay, and it's also where it is created by means it is created by some of the departments like main department means international federations. Okay, international federation pharmaceutical federations. Okay, in the year of 1992. Okay, next every pharmacist should be prescribed. Okay, every pharmacist should be prescribe and make sure that offer suitable possible for the each patient. Okay, from the patient. So from the side of practice. Okay, from the side of from our side means it is our side means our way are called as practitioners. Okay, the pharmacists are also called as practitioners should make the knowledge about the drugs and give it to the patients. Okay, such type of the drugs such type of the drugs given to the patient means first we have known about the drugs. Okay, this is the concept. Next. What are the aims? Okay, from the study of good pharmacy practice in the hospital. First one is aim. Okay, next we are going to discuss requirements. Okay, first we are going to discuss aim. What are the aim? Followed by what are the aims? Followed by the good for the good pharmacy practice. Means first one is the goal of GPP. Okay, the goal of GPP is offered to the drugs. Okay, the goal of good pharmacy practice is offer to the drugs and other and healthcare goals, services and guide people to say about the effective method of using it. Okay, this point mainly tells about the drug medicines or the practitioner can knowledge about the drugs and what are the effectiveness of the drugs are also involved. Okay, the effectiveness of the drugs and the knowledge about the drugs. Okay, and how to distribute the drugs. Okay, how to distribute the drugs to the good way manners. Okay, how to distribute the drugs from our side to the patient side. Okay, this is the first one. Okay, next one is the comprehensive services. Okay, comprehensive pharmacy services are also include the participation's initiation to protect public health and prevent disease. Okay, the main role, for example, if I am the practitioner means what I am giving to the patient means if the patient can admit in the hospital means what I am thinking means if the for example, the patient can only what I am thinking means my side means first of all the patient can treat purely. Okay, first of all the patient can treat purely. Okay, this is my point. Okay, that's all. That's like we are all the practitioners. Okay, we are all the practitioners. We serve to the people. So we serve to the public sectors like patients. Okay, this is the main role. Okay, and likewise includes the participation. Okay, like the participation of the practitioner. Okay, the participation of the practitioner is the most important to the patients as well as our sides. Okay, our side. Next, in the quality of each medication. Okay, the quality of each patient medications usage procedures should be guaranteed. Okay, the quality of each patient. Okay, if the patient can admit it means how the patient can act. Okay, how the patient can act into the such type of disease or such type of the disorder means how we will act. Okay, how we will act. We will act like we think the quality of the medicines are given to the patients, given to the patients, or the patient can also take it. The patient can take the medicines or not. Okay. Likewise, we think it about the patients as well as about our sex. Okay. Next we are going to discuss requirements. And what are the requirements? Okay. What are the requirements are followed by the good pharmacy practices? Okay. First one is according to the GPP. Okay. According to the good pharmacy practice, the pharmacist can priority every context should be patient welfare. Okay. The first point is the main point. Okay. The patient welfare. Okay. The patient welfare is the most important thing from our study. Okay. Good pharmacy in the good pharmacy practice means the patient welfare is the most important. Okay. Next one is the revision of standard quality medications and other healthcare goods, relevant information and counseling to the patients with monitoring effect of the use. Okay. The first one is the revision of quality standard quality medications. Okay. The revision of if I am the practice means first of all what I am known about the standard quality of the medication. Okay. First of all, I am known about the standard quality of the medication. What are the quality of the medications were from given to the patients. Okay. What are the quality medicines known from about my side. Okay. These are also the main importance by the and other healthcare goods. Okay. What are the healthcare goods? Okay. Like healthcare goods. What are the healthcare goods followed by the hospitals? Okay. What are the healthcare goods followed by the practitioner pharmacies? Okay. Other technical staffs. There is a hospital assistant staffs. We are all know about the healthcare goods are available in the hospitals. Followed by or otherwise followed by the hospitals. Okay. Next, relevant informatics and counseling to the patients. Okay. Relevant informatics. What are the relevant informatics collect from the patients? Okay. What are the relevant informatics collect from a patient side and counseling for the patients. Okay. If the patient can relevant from such type of disease or disorder means what type of the medicines are given to the patients or otherwise what type of the medicines are given to the patients or otherwise counseling. Okay. Counseling is the most important. So if the patient can admit means they thinking to they think like overthinking. Okay. How I am pure. Okay. How I am pure. Okay. How the doctor can treat the medicines. Okay. Likewise the patient can think overthink, imagine. Thinking like over imagine. Okay. It's the most important. Counseling is the most important. Likewise, the practitioner can involve the patient. Likewise, the patient can. Likewise, the patient as well as the pharmacist can both interact and treat counseling. Treat counseling to the practitioner means I treat with the patients such treat in a good way manner. Okay, such a treat in a good way manner. It's like a counseling. Okay. Next, monitoring the effect of the use. Okay, monitoring the effect of the use means the taking of the drugs. Okay, for the taking of the drugs is one of the monitoring. Okay, to the patients. Next one is the final one is the pharmacist responsibility should include promotion of rational and cost effective prescribing and proper drug use. Okay. The pharmacist, we all know about the pharmacist responsibility. Okay, what are pharmacist responsibility means? First, we are known about the first. My side means main thing is the patient cure. Okay, the patient how the patient can treat, how the patient can take in the medicines. Okay, these are all the most important. Okay, and the patient counseling and good pharmacy practice in a good way manners. Okay, and the direct patient care. These are also the pharmacist responsibilities. Okay, and the promotion, the national and the cost effective prescription and the proper drug use. Okay, taking for example the patient can admit to the hospital means how the patient can take the medicines. Okay, it taken in a good way or bad way. Okay, what time the patient can taking the medicines. Okay, likewise we counseling the patients. Okay, that's all. Okay, that's all about the overall the study of good pharmacy practice in hospitals. Okay.